Hi everybody, Jessie here from Team IBS Dietitian. Today, Brooke and I will do one last office hour for September. We'll have more office hour in October as well, but we have not decided on the dates. Let's see. Hi everybody, thank you for joining. Let's wait for Brooke to get on. And today we are going to talk about cost of IBS. And also what to do if you have IBS constipation, what to do if you have IBS diarrhea. And let me bring her on. Hi, I'm doing great. How are you? Somebody asked. Okay. Cost is because, of course, there is everything is going up. Inflation is kind of high in the US and probably in other parts of the world as well, but healthcare costs has gone up significantly over the past few years for everyone, right? It's not just your doctor's cost, but also your insurance cost. And when we live with a chronic condition, both of us have IBS, so we can understand, we are constantly spending money on healthcare. So we want to kind of talk about that. What are some reasonable things to spend money on? What are things that are not validated from science standpoints, so you can save your money? And we are, of course, IBS Freedom Program is our program. We are enrolling right now. We have at least 3 of our clients that just enrolled in our program have done the food sensitivity test, which is a complete waste of money. It's not evidence-based. And everything you eat will show up positive, and people become very afraid of food. So we're going to talk about those things as well, like things you don't have to spend your money on. That's going to not give you valid information and can cause more harm down the road. We'll also talk about the gut microbiome testing as well, which is also, again, something we see people are doing more and more. And as these companies are directly selling to consumer these days, there is a reason why your gastroenterologist or maybe your primary care provider don't order these tests. And we're going to talk about this. And of course, like I said earlier, we'll talk about what to do if you have IBS-C, what to do if you have IBS-D. And also a quick reminder, the IBS Freedom Program, which is our small group VIP program to work with us directly. The enrollment of it is closing tomorrow. So if you are interested in getting our help and working with us, just a quick reminder, today is your last chance to maybe watch our free IBS Masterclass to learn more about our approach, or to listen to our podcast episodes where we have past clients come on and share their story and share how they found IBS freedom via our program. Okay, so let's kick it off, right? IBS is not just about symptoms, right? It impacts finances, it impacts our work, it impacts our relationships and daily quality of life. In fact, last week, sorry, I'm going to pop this back. We shared the IBS survey in America for 2025, and we talked a lot about this. People lose about 11 days per month of productivity on work or school because of IBS. And they also change what they have to do on personal things for about 8 days a month because of IBS. And that combined together is 19 days out of a month being affected by IBS symptoms. And I kind of want to see, for our audience that are watching and listening here, is that your experience with IBS? And feel free to share more. What is your experience? Yeah. Brooke, you want to chime in on anything? Oh, maybe we can start talking about medical costs, right? Yeah. Let's do that. What are normal for IBS patients? What are normal for somebody who starts having gut symptoms? What are some of the initial steps that we recommend people do?
Definitely to go see your doctor. And as we've discussed before, sometimes it can take up to 6 years to get an IBS diagnosis, and also finding or trying multiple gastroenterologists until you find that one that kind of listens to you. That's very common. So having to try multiple different doctors, multiple different, so they're not going to diagnose you with doing some testing. So if your insurance doesn't cover it, usually insurance should cover at least partially tests that doctors are going to order. But if if you have a copay or a deductible or something like that, that's going to add up. And then it can be, so that's the beginning of medical, legitimate medical testing. And then sometimes people that don't get an answer from their doctors will try a functional medicine doctor, which can then lead to some testing that's not validated, which then leads to multiple supplement recommendations, which is going to cost a lot of money, because that's where they make their money.
Yeah, and unfortunately, sometimes with the illegitimate doctors, like they call themselves doctors, but they're not medical doctors. What they do, sometimes their practice is, they're very good at listening, which I think we can, in traditional medical spaces, we can do more of that, because when we are providers, right, the connection with your patients and listening to your patients is always key. But because of the way healthcare is set up with insurance reimbursement is usually not practical, and probably just not possible for doctors to spend more than 15, maybe even 20 minutes with you, because they have to bill insurance. And it adds up really quickly. So, but finding that right provider that will listen to you is really, really important. And you also need to do your due diligence as a patient, right? Document your symptoms. Document maybe your food intake for a few days, maybe document your stool, your bowel movements, like document as in picture, take pictures of them. And then when you go into your doctor, you can show them, hey, this is what I'm eating, this is what my bowel movement looks like, and here are my symptoms, right? And when you're telling your doctor what symptoms you have, you also want to let them know, you also want to document, more detail about those symptoms, right? Brooke, do you want to talk about maybe explain bloating? What do we want to see when we ask people about their bloats or about their pain?
Yeah, so for bloating, first of all, there's bloating, which is a feeling, and distension, which is actual distension of your belly. So they're actually, you can have both things, but they're distinct kind of characteristics. So bloating is, I think, one of the hardest things to help people with, because there can be so many factors for bloating. It can be swallowing air when you eat, drinking with a straw sometimes, is it constipation? There's so many factors. You got to trial and error a lot of different things to see what's going to work and what's not going to work.
Yeah, I love that. So like what Brooke would say, there's so many different causes to why somebody bloats. So if you do bloat, what you need to do is to document your bloats, right? Where in your abdominal area is it at? Is it upper? Is it lower? Is it in the middle? Is it everywhere, right? How long does it last? When does it happen, right? When does it happen? And when it happens, how long does it last? And then what else? Does it correlate to bowel movements, right? Yeah. Or does it correlate?
Or do you wake bloated?
Yeah. Do you wake up bloated?
During the day?
Right. Do you bloat overnight? These are all things that we look at to help the patients better understand, hey, what may be causing your bloating? Is it food related? Is it defecation related, right? Is it bowel movements related? Or is it something else, which could also be SIBO, right? Dysbiosis of the GI tract. Like these are all things that give us a good understanding of what may be causing your bloating. And this is the same for pain, right? When people tell us they have a lot of pain, the first thing we ask is, where is your pain? Document your pain. How long does your pain last? What type of pain do you have? Is it short pain? Is it dull pain? Is it constant cramping kind of pain? And then how long does it last, right? These are all good information to kind of give us a sense of what may be causing it. And then you link the dots between, okay, a person has this type of pain, they have this type of bloating, and then they have this type of defecation pattern, right? And these are the eating patterns that they have. Then that's what gives us a really good clue of what may be causing your combined IBS symptoms. Because it's never just one thing over another. It's the pattern that we are looking at. And so we were talking about when you go into your doctor's offices, right? You need to do your part to document everything, to bring it in to your physicians, right? And then share all of this information in that 15 minutes that you have with them, which is the tricky part. Now, if you have seen your primary care physician and they don't know what to do with you, the next step would be going to a gastroenterologist. And if you can find a gastroenterologist that is proficient, right, in understanding IBS and treating IBS, and that would be the best case scenario. You don't want to go to somebody who is not a specialist in IBS, because IBS is so complex, and oftentimes, you know, like we talked about earlier, you need to look at all the different pieces to connect the dots. An experienced provider, after hearing your symptoms, after looking at your bowel habits, they can, and usually they will be like, okay, here are the tests we want to do. We want to test you for celiac disease, because that's usually the number one thing that we want to rule out. If you have significant diarrhea, they would probably want to assess for inflammatory bowel disease as well. And there are multiple ways to assess for inflammatory bowel disease. They can do a stool test and measure your calprotectin. They can do a biopsy, or they can do colonoscopy and then they will take biopsy to see if everything looks okay in your colon, right? There are so many different tests. Now, if you have diarrhea related to fat malabsorption, right? If you have nutrient deficiency, then they might run tests like the fecal fat test, or the pancreatic enzyme elastase test. Like, these are all things that we, actually look at for our patients when we say, okay, here are your symptoms and here's your bowel movements, and let's look at this closely and see, do you need extra tests to rule out other overlapping conditions with IBS? IBS is it's a disorder of the gut-brain connection. That is what is being key the term. However, within IBS, there are so many causes to why people have symptoms. If you don't know what is truly causing your symptoms and just say it's all IBS symptoms, then you can't really find the relief, right? Whether it is constipation or it is diarrhea. But work with an IBS expert is key to really help you bridge the gap of like, okay, here are my symptoms. Here's what I need to do. And once you know what's causing your IBS symptoms, then it comes the right treatment plan, right? The treatment plan could be medication, could be certain targeted supplements, right? Sometimes we do recommend fiber supplements or maybe targeted enzyme supplements, but these are recommendations after we know whether you have a food intolerance or not and what these foods are. We don't just recommend a blanket enzymes like, oh, go take this, it will cure everything. No, it won't cure everything. In fact, you're just wasting your money on things that you don't need. And we know even the enzymes with evidence to them, they're quite expensive. They're like $70 a month per month of supply. At the minimum, right? If you don't need to spend that kind of money, you don't need to spend that kind of money. If you have lactose intolerance, we can recommend lactates. If you have a GOS intolerance, which is beans and legumes, then we can recommend Bino, right? But if you don't need it, if you don't need a combination of FODMAP enzymes, then you don't need to buy it. You can buy individual ones that is what you need, because the combination ones are quite expensive. And if you don't know what you are intolerant to, you're just using a combination ones. It's like $100, easily over $100 a month if you're using it 3 times a day. But if you know what you don't tolerate and then you use the targeted ones, it's so much more convenient, right? If you know you have lactose intolerance, which we know in the IBS population, a lot of people do. You can use lactate when you are consuming lactose-containing dairy products. You don't need to use it with every single meal, right? Because we're getting a bit into like food intolerances here. But what were we saying? Oh, we were saying about the cost, right? We were saying about going to PCP and then going to a GI and then document all of your symptoms before you go in to see any of your doctors so that they can order the right test for you. or refer you to the right specialist. If they do suspect a food intolerance, sometimes they would recommend a low FODMAP diet and tell you to figure it out on your own. We do not endorse that. But there are GIs, like what our clients, Lauren, said, like she just sent Lauren right to us. She was like, you need to work with these ladies. They are GI, IBS dietitians, and they know the low FODMAP diet in and out. And we, of course, worked through with Laura, and got her the right diagnosis because she actually had SIBO, right? And got her treated with SIBO with her GI doctor. And also reintroduced all the FODMAPs for her. And we identified her food trigger so that she knows what FODMAP at what amount actually triggers her symptoms. And she doesn't have to cut out all of the FODMAPs. Yeah, she's been doing that for maybe about 5 years, right? Cutting out food, trialing elimination diets by herself. And I have to say, elimination diets are not benign. It's extremely difficult to implement. It's extremely difficult to do the challenge process by yourself. And it's also extremely confusing to look at the challenge results. If you don't know what you're looking at, how do you know whether you tolerated it or not? And that's where an IBS dietitian come in from and say, hey, looking at your challenge, right? You eat this over 3 days. All of the challenges, no matter what food it is always multi-day challenge. It's never just one single meal and we see you react or not. It's usually multi-day. Start with a very small amount and then you eat a bit more, and then up to a full serving. And we monitor symptoms. And what are these symptoms? It depends on which FODMAPs you're eating because some of them are osmotic. It means they draw fluids into your gut and can cause your stool to be more loose. All of the FODMAPs are short-chain carbohydrates, and they are rapidly fermentable by our colon, so we monitor bloating and gas as well. These are potential symptoms. But most of the time, once you resolve what is going on with your GI tract, you will be able to tolerate more FODMAPs, more foods without worrying about symptoms. And that's exactly what happens to Laura. She cut out a lot of food for a long time, and after we do the group by group challenge, we found that she only had one group of FODMAPs that she didn't tolerate at high level. So she actually, technically speaking, tolerated all of the FODMAP groups. Okay, and that one group is actually a combination group of FODMAPs. It's the stone fruits group, which is apples and pears and peaches and cherries. She can eat that group in small quantities. She just cannot eat a large amount without having, well, when she eats a large amount, she may get some symptoms, right? But she knows she can tolerate the smaller amounts and she can eat them again. And she was able to actually reintroduce everything. And knowing that, you know, what causes her symptoms, at what quantity, she can avoid symptoms at all times. And she was somebody who came to us with significant diarrhea. And she has worked with her GI for 5 years with no resolution and no improvement to her symptoms or to the quality of her life. And for many of you listening, you would know that, you know, sometimes if we have to use the bathroom, you have to go, right? And she was one of those people that even driving to work gave her anxiety because she doesn't know if she can get there safely without having an accident. And for those of us with IBS-D, for those of you with IBS-D, you would know what I mean. And for those of us with IBS-C, we know what that means because sometimes we take over-the-counter laxatives to help us have full evacuations, right? And sometimes when that happens, you need a bathroom, you need a bathroom. So, you know, if you feel that way, if you feel like, if you feel alone in how you're feeling with all of these symptoms, know that you are not alone. There's so many people out there just struggling. And because IBS and poop patterns are such a taboo topic, we don't talk about that enough. Okay, now let's go back to, you know, the cause of IBS. Now we talked about going to PCP, going to GI, and then also please don't do elimination diets by yourself. And then tests, we also kind of talked about tests that doctors may order for you depending on what symptoms you report to them, right? And then now let's talk about the invalid tests that we often see directly sold to consumers or sold by practitioners who don't follow evidence. Yeah, we talked, yeah, do you want to go ahead?
So,
yeah.
Yeah, so the gut sensitivity testing, microbiome testing, there's a breath and over-the-counter breath test where you breathe into something after every meal, to see how you tolerate it, which, yeah,
Nope.
yeah. So,
If it's not a
no.
test recommended by your GI, don't do it. So
Mm-hmm.
now let's break down
Mm-hmm.
all of these tests, right? Because we are enrolling IBS Freedom Group Program right now. We are closing our enrollment tomorrow. So for those of you who are interested in working with us, get our help, make sure to check it out. You can always comment on any of my posts with the word group, and I will send you 3 links to learn more. One is the program page. Number 2 is our free IBS Relief Masterclass. And number 3 is a link to book a call with me. I think I have a few availability tomorrow for a call, but check the link. If not, send me a DM. If I don't respond, send me one more DM, because I do have an automation set up with my DMs, because I receive a lot of DMs, so I may not see your message, but send me multiple DMs so that I will hopefully catch it. But, send me a reminder every day. Okay, food sensitivity test. So food sensitivity test actually measures IgG levels, and IgG level is not a food intolerance marker. IgG is not a food intolerance marker. What we know so far about IgG is that whenever you eat a food, you're exposed to a food, your body produces IgG to say that, hey, you've eaten this food. This is a marker so that we know you ate this food. And what we, scientific community, think these days is that this might be a marker of recognition and potentially a marker of tolerance. So it's not a marker of intolerance, which is also why when people do the test, everything they eat will show up as positive, 1 degree to another, right? Some of them would be red, some of them would be orange, some of them would be yellow. I don't know the color coding system, but one of our clients did that. And I would tell you, it's like 40 foods on there that's marked as sensitive.
Mm-hmm.
And our first recommendation is, hey, toss it. Don't worry about it. And you may think that spending a few $100s doing a test like this is okay, if you have the money to spend, right? If you have the, but there are actual harm being done with these tests, is that people become more and more afraid of eating. And we are talking about eating the food that they eat every single day. It's like, okay, I eat potatoes every day, but now this thing says that I'm intolerant to potatoes. Am I going to continue to eat it? If I eat it, if I have symptoms, is it because of the potatoes, or is it because of the bananas, the apple, the eggplants, the tomatoes, everything? Because everything is marked as intolerant on these tests at a varying degree. It's like, it costs people their relationship with food, right? Brooke, you want to chime in? Because we have seen so many cases.
Yeah, we see that a lot where people have cut out many, many, many foods based on those intolerance tests. And recently I had someone, and I don't remember what the food was, but I said, what would happen when you ate that food? And she said, nothing. So I said, exactly. So it just restricts your diet way too much. And I have heard a lot of kind of people more on the research side of things saying somewhere down the road, testing like that could be helpful. But at this point, there's just no science that says it's helpful. And what we see in practice is that some foods that people eat every day and tolerate just fine, they've been told to cut out. So that to me just means it's not worth cutting out that list of 40 foods that you eat all the time, because it's more than likely that you don't have a problem with those foods.
Yep, exactly. And of course, if you're cutting out all the foods that you eat, it makes it really difficult to live a normal life.
It's scary.
It's very scary. So when you go out to eat, you may not have control over what is being served, right? And if you can't eat things that actually won't give you symptoms, like, oh, I'm just sorry. And it's missed experience as well with your families, with your loved ones, with your friends. Okay, so that's the food sensitivity test. If any of you listening here, if you've done it, throw it away. Don't look at it again. Shred it, compost it, or whatever you want to do with it. Burn it, actually burn it. Do a ritual, burn it, and be like, I can tolerate these foods. The
Yes, yes.
marker is an indication of tolerance. It's not an indication of intolerance. And, help yourself celebrate that you can actually tolerate these foods. Okay. So that's one. And then another food related test is a direct to consumer breath test that we are seeing that have ridiculous amount of marketing budget, right? Because it's showing up on our feeds all the time. We don't want to say the names, but then there are multiple brands. Some are in Europe, some are in UK, some are in the US, and they claim that after you eat certain foods, you blow into this breathalyzer and they can analyze whether you tolerated the food or not. Again, there are breath tests that has been done, that can be done in hospitals to help you identify whether you have a fructose intolerance or a lactose intolerance. But when you are doing it in a laboratory setting, in a hospital setting, there are multiple requirements that needs to be met, right? There's fasting requirements. There's like what you can eat leading up to the test requirements. And then there's hygiene requirements when you're blowing into these machines, right? We know that breath test, at-home breath test has about 47% false positive and false negative rates when it comes to SIBO breath tests, right? These food intolerance breath tests, they have no accuracy at all. And again, what it does is it makes people more afraid of the food that they are eating. And which is also why an experienced GI dietitian will not ever recommend these, because why add to the anxiety? Now, if you do suspect a food intolerance, the only way to identify whether you do have an intolerance is an elimination, a proper elimination with a systematic reintroduction. And with the reintroduction, it's over multiple days at various levels so that we are identifying what your level of tolerance is so that you can eat that food again safely at the amounts that you tolerate and not cause any more symptoms. So again, if you do suspect a food trigger, like all of the clients that we work with, they come to us trying to identify the food trigger. Sometimes we uncover things that are bigger than that, like getting them to the proper diagnosis. But a lot of the times what we really do is hold your hand in a structured way to identify your food trigger so that you can live your life normally after knowing what will cause you your symptoms and what happens when you eat them, right? So you can have the tools to manage symptoms if needed. But the key is really to know what causes your symptoms and to avoid them so that you don't have symptoms and you can, travel as you want, go out to eat as you want, as long as you are avoiding your triggers. And then also not worry about things. Now that comes if you are constantly worried about symptoms, like some of our clients got onto our podcast and talked about this, the anxiety will linger after the program. But every day without symptoms and every day knowing how to manage your symptoms will bring you better peace of mind and actually your anxiety reduces as time goes. Who was that? Lauren, one of our younger clients who came on to our podcast, and she said, I think one of the things we asked her is she's used to take Imodium just to manage her IBS diarrhea, right? And she said, she still has anxiety, but when she talks about when was the last time she had to use Imodium, and she was like, she hasn't used it all summer long. Mm-hmm. And there were multiple events over that summer where in the past, if she has to make it to these events, she has to bring Imodium with her just in case, right? And this time she still has some anxiety, but she didn't need any of the Imodium. And that is a huge win, right? But for those of you listening, right, once you know what it is, then it will really help you be more at peace moving forward and really reduce that anxiety level. Okay, last invalid test that we want to talk about, right? The gut microbiome testing. Do you want to kind of talk a little bit about what that is?
So it is a stool test, and they measure levels of different substances in your stool, and from those amounts, then it's my understanding that then there are usually supplements recommended to rebalance your microbiome. There's so many things wrong with this.
Yeah.
One, what's in your stool isn't necessarily a reflection of what's in your gut microbiome. And usually it's a lot of supplements. That's usually what we see. People come on a lot of supplements, which is a lot of money.
Right, added cost to your treatment of IBS or management to IBS. Yeah, and there is a whole business model. So when we went to, there was every year there is a digestive disease conference, this biggest GI conference around the world. So we went to one in 2023, and one of the sessions was about the business model of gut microbiome testing. So basically stool testing. So what usually happens is a patient goes to their GI or maybe multiple GIs and they don't feel hurt. And they finally go to the alternative route, right? Functional or holistic approach or whatever, naturopathic approach. And these doctors will prescribe like, well, why don't we take a look at your gut microbiome to see if there are some bad bacteria growing in there, or maybe your good ones are not enough. So, and people, our nature, I think we just like to get tests. We'd like to feel validated with these tests, right? So we want to do the test. However, these tests, one is not mature. Number two is they don't have enough data to show us what is normal, what is not normal. Brooke and I live in Seattle. Brooke lives around DC. We have really good gut microbiome, but our gut microbiome would look very different. And if we do these tests, you know, something will be flagged as probably abnormal because there's not a complete data out there, right? And when you do these tests, there's Dr. Fong came onto our podcast and she said there might be 2% used to these tests. Is you get a breakdown of what is in your stool. Now, like what Brooke said earlier, what's in your stool is not a reflection of what's really in your GI tract, because some of the microbes in there are better at shedding, so you see more of them in your stool. And some of the microbes, they are better at anchoring in your GI tract, so they are less likely to shed, and you're not going to see that in your stool. So oftentimes with the business model, right, you do the test and they'll be like, oh, you have too little of the good microbes or this multiple groups of the group microbes, right? Then they're going to try to sell you probiotics to fix it. And then they might say, oh, you have too much of the harmful microbes. And then they're going to try to sell you, what are those called? Antimicrobial to try to kill those off. When in reality, science doesn't know what is a good combination. At this time, we don't know what is a good combination. We are actively learning. There's a lot of research trying to learn it, but unfortunately, a lot of researchers want to monetize what they have researched prematurely. Do we think there will be useful data coming out of this? Yes, maybe, if we continue to pour a tremendous amount of money into the research, right? Maybe one day we can, but we don't know when that's going to happen. From what we are learning from different conferences, we don't think it is anytime soon. So that business model, right? You do the test, they sell you the supplements to try to fix your gut microbiome. And sometimes they might even put people on elimination diets to be like, oh, you can't eat this because it's going to feed into, you know, the overgrowth or whatever. And then that's like money wasted on the appointment, money wasted on the test, money wasted on supplements, and then your relationship to food harmed because they're telling you all these things. And then what happens next is they do a retest in maybe a few months, and then they adjust their protocol to you. And, you know, it's an endless cycle. And we have seen so many of our patients who have done these things, wasted thousands and thousands of dollars just to do the test, try the supplement. And also another big red flag when you're being recommended so many supplements is that in the US, supplements are not regulated. You really have no idea what you are taking. And it can be very dangerous because there could be heavy metal in there. There could be chemicals mixed into it that you don't know of. And there could be, well, what they list on the ingredients list may not actually be in the supplement. So you don't really know what you are taking, right? And on that note, if you are taking any supplements, make sure you get something that is third-party tested. I have a profile highlight on supplements. Go check it out. Look for that. The third-party testing organizations that are actually reputable. So look for their logos on whatever you're trying to buy. But most supplements out there, especially GI supplements, you will not find those logos because most of them, there's no evidence supporting that they actually help. Okay, we've talked a lot. So we're talking about medical cost associated with IBS, right? Doctor visits, legitimate tests that you need, illegitimate tests that you don't need, and then let's talk about medications, right? Medications can be a big part of managing IBS. It could be over-the-counter laxative. It could be over-the-counter anti-diarrhea medications. And it could be, what else? It could be prescription medication, right? Some of it do help, but you have to find something that works for you, right? There are, I think, there is over 20 or 30 prescription medications for IBS. You know, if one doesn't work, ask your doctor to try another one. And there are some that works quite well. And usually it's a combination of treatments, right? Medication can be one of it. Diets, modifying diets can be another one, especially for people with food sensitivity, well, food intolerances, right? Not food sensitivity. And then number 3 is making lifestyle modifications. And then now let's talk about the emotional and lifestyle cost. Emotional cost or life cost when it comes to managing IBS. So we talked about it earlier, loss of work days, that's a huge one, and loss of personal days, right? And AGA just released this report in August. So for IBS patients, people lost on average about 19 days out of a month because of IBS symptoms. It may not be a full day of loss, but there would be symptoms affecting how they planned their day. 11 of those days are productivity related, so work or school, and then 8 of those days are personal activities. So altogether about 19 days, which is a huge quality of life factor when you have IBS. And, you know, I think with this report, what I'm really hoping is seeing more research dollar going into finding better treatment options for IBS. Yes, we have quite a good amount of treatment options, right, available. But I think the gap is, you know, with IBS, with how complex it is, it's something you need to see your provider more consistently to get good results. We know that because even for us, you know, as good as our clinic is, if we see a patient, say maybe I see you every 6 months, I don't think I can really help you get over the hump of, you know, understanding what's really going on in your gut or understanding what food triggers you have, which is also why we really like our program, because we are seeing our patients every week for 14 weeks. When your symptoms change, we need to come up with we might need to change our approach to what we recommend. So it is very important to work with your providers closely, monitor your symptoms, right? Monitor what you're eating, what your bowel habits looks like, monitor your symptoms, your bloating, your pain. And some people have reflux as well. Some people have other symptoms too that we also monitor, like nausea. Sometimes we hear people having migraines, having joint pain, having other aches that may or may not be related to IBS, right? There are overlapping conditions. Usually people would report those symptoms. Okay, so that's the emotional cost. Do you have anything? Do you want to add something to that?
No, I think you covered it.
It is a lot. Well, last but not least, right? I think one big cost that we did not talk about is how IBS symptoms, you know, for those of you who may be listening who may not have your IBS fully under control. What do I mean by fully under control? It's like you're mostly symptom free. Like for me, as an example, when my IBS was flaring up before, one of the symptoms that was constantly draining my energy away was the dull pain in my abdominal area, because I am IBS-C. And for those of you who are C, if you're not going to the bathroom for a few days, there will be pain, and then there will be dull pain, and then there will be bloating and trapped gas. And one of the things that really struck me to why I needed to resolve my IBS at that time was I had young kids, and I was really short-tempered with my husband, who is also an IBS-C patient. I'm very short-tempered with him. I'm very short-tempered with my kids. And my kids were tiny. They are itty-bitty, right? During that time, you really need to give them 100% of your love, to the extent that you can, right? Being a mother, we know it's really, really hard to do that sometimes because they like to push buttons. But then when they're little, they're not really pushing buttons. It's just, they need the care. And I wasn't there for them 100% because I couldn't. I was just painful all the time. It wasn't the kind of pain where sometimes we hear from our patients where they go to the ER because it's so scary. Oh, we didn't talk about the ER cost. That's a big one because people do go to the ER when they have, nonstop diarrhea, right? When they go to the ER with significant IBS pain. But for me, it's that dull pain that was constantly there. And I just remember sitting on the rocking chair, the mother's chair where you breastfeed. I'm like, I can't take care of my kids. I can't do things that I want to do, or I can't be 100% of the person I want to be because I have that dull pain all the time. Now, I think that brings us to talk about our next topic really soon, is what to do when you have IBS constipation. And then we'll talk about what to do with IBS diarrheas as well. But, once you have better gut motility, the pain will usually go away. Sometimes people may still experience some pain because with IBS, it also comes with the gut hypersensitivity. But one thing we didn't talk about earlier with the medical costs is ER visits. And unfortunately, ER visit is pretty high up when it comes to managing IBS. When people have nonstop diarrhea, they worry there's something really bad going on in their guts. They go in, they get the scope, everything is fine, and the doctor just look at them like, hey, it's okay, it's just IBS, go follow up with your GI. And patients feel like they feel like they are not validated when they hear doctors say that. Now, we want to tell you that your story is very real. We hear this all the time. I think it's also hard for ER physicians to understand what IBS patients are going through because they see trauma patients a lot of the times. And if everything is okay with your guts, nothing is really wrong. There's no bleeding going on, which is always a good sign. There's no active inflammation going on, which if they do a scope in the ER, that's what they're going to be looking for. If everything is okay, to them, this is not life-threatening. To them, this is something you can follow up with your physician, which is a good thing. If you have a clean bill of health, one of our patients came onto the podcast and said that, I have a clean bill of health, but I don't feel that way because of my IBS. Your feeling, your story is very much validated. And, in hindsight, right, for most of us with IBS, we know that it is good to not have any problem. My husband actually did an endoscopy and colonoscopy earlier this year because he started having some upper GI symptoms again that we were worried that it could be his IBS related, right, or something else, coming into his IBS. And he did the scopes and everything is okay. Thank goodness, right? Thank goodness everything is okay. Because he's also past the age of 45 where you have to, where it is recommended to do a scope every 10 years to make sure there's no abnormal growth. And in the past, at his worst when it comes to IBS, he had a lot of reflux. He had multiple vomiting episodes. We actually found mild erosion in his stomach, right? This is also something we see quite often with IBS patients. And I'll tell you, for him, this year when he did the scopes, it was clear. There was no erosion. And the reason why we asked for the scope is because he had a couple vomiting episodes. And I was just, as a GI dietitian, I'm always saying, well, things are escalating because Because for both of us, most of the time we don't have any IBS symptoms, but he did have a couple vomiting episodes, which now, given that there's no more erosion in his stomach, we think that it might be, there was something else. I can't remember the name. You know how we have the diaphragm and then your stomach protrudes a little bit out of the diaphragm. What is that called?
Hernia.
Yes, he has hernia. So we think that most likely one is stress related. Number two, it could be the hernia. So that's not something we can fix. And most of the time you can manage your symptoms pretty well. But for him, once we got the scopes done, we're feeling so much more at peace. Like, okay, there's no abnormal growth in his colon. There's nothing wrong with his stomach. Because we do want to check on the erosion once in a while to make sure it's not getting worse, right? Erosion can lead to stomach cancer down the road, and which is really prevalent in China. And there's another thing that is very prevalent in China is H. pylori, and we want to just get that tested to make sure it is not H. pylori. Anyways, that, of course, is another medical bill, right? Anybody who has done scope knows that. It's like, it depends on your insurance coverage and whether you've met your deductible or not. It usually ranges from a couple $100 to maybe like $2,000-3,000 or $4,000 or $5,000. In Seattle, everything is really expensive. And thankfully, we do have good insurance coverage, and he's met his deductible, but otherwise we would have to pay maybe $2,000-3,000 for it. When I did my scope, I only got the colonoscopy. I think I paid about $1,000 for it a couple years ago. I know this year is a little bit more expensive, but you need to get it checked out, right? With IBS, what we really need to make sure is nothing else is wrong, because if something else is wrong, treatment could be different. If it's IBD, there are medications to help you. But if you do have IBD, we work with IBD as well. And what we do is we help people understand, if there are food intolerances going on that could be making IBD worse. One of our clients that just got onto our podcast that was released a couple of weeks ago, she has IBD. She has microscopic colitis, which is a very common overlapping diagnosis with IBS. But know that, sometimes there are medications that can help. And sometimes if you do have a food trigger, you need to identify it. Okay, I'm going on and on and on here. Let's talk about IBS, right? Let's talk about IBS-C. When it comes to constipation, what are the most important things we need to help our patients work on?
Going to the bathroom every day.
Yes.
Hydration, fiber, and one of my personal favorites is protected bathroom time. So you allow your body the time to have a bowel movement. But it can take a while to work through all of the steps and get where we want to be and figure out if there are any food triggers.
Yeah, that's the key, right? I think with IBS constipation, what people don't understand is if you are constipated, it takes time for your gut to heal. You have to have full evacuations every day. Well, if not every day, at least every other day, right? Because when we are significantly, this could be a good tool. When we are maybe this is a normal colon. Where's my poop thing? Let me grab my props. Okay. Oh my goodness. I have some group props to show you. And we have seen this in X-rays or CT scans from our clients. When they come in, if they're significantly constipated, right? This is a normal colon. Your poop just kind of goes through and it comes out. This is a constipated colon.
That is great. I didn't know you were going to pull out the big pillow.
You see how stretched out your colon is? And we have seen a lot of this in our patients, and some of them are constipation patients, are diarrhea patients, because this is causing them to have overflow diarrhea. If you don't know what I'm talking about, you need to watch our free IBS Masterclass. We have really good graphics that breaks down what overflow diarrhea is. It's one type of diarrhea that's caused by constipation. But anyways, if you have a ton of stool stuck in your colon, right, the key is for you to have full evacuations daily. And when you have full evacuations daily, your colon will slowly shrink back to its normal size. The degree of it going back to its normal size and how fast it's going to go back to its normal size is going to vary person to person. But in our experience, it does happen. You know why? You know why we know this? Because we look at our patients' poop. We can see that our patients have ginormous poop when they start working with us. And what we really help them to do is, work on all the things that can improve your gut motility, and eventually they have normal size stool. And what we want to see at the end of the program is they have consistent normal size stool, so that we know their gut has shrink back, right, from a ginormous gut to slowly shrinking back to a normal gut. Mm-hmm. When you have a normal gut, it's going to be a lot more sensitive to having stool in there. And when it senses there are stool in there, it will, trigger the contraction to be like, hey, I need to go to the bathroom now, which is why people tend to get a better sense of urge, too. But for those of us with constipation, myself included, I know, here's the tricky part. If you are not having consistent full evacuations every day, you let your bowels speed back up again, it's going to stretch out your bowels again. And when it stretches out your bowels again, like we kind of have to go back to square one to start over, to retraining your bowels. So the key is really having that consistency and really having full evacuations daily, if not daily, maybe every other day. You really don't want the stool burden to build up again and stretch out your colon again, which is where we find, if you are going to see a provider every 3 months, they can recommend one thing, right? But if they're not monitoring your progress and saying that, hey, you need to increase maybe your over-the-counter laxative, then, it's going to stretch out again, which is also why when patients, which is probably also why only 1 in 5 IBS patients are happy with the care they're getting. Because with IBS, you really do need that consistent touch points with your provider, because things will change. Like you will have normal bowel movements for a few days, right? But if you are not consistent with things, the changes that you need to make, it can, the stool burden can come back and it will slowly stretch out your colon again. Now, it may not get this big, okay? I'm sorry, I couldn't make it even smaller. But, that is a visual to show you, like with IBS constipation, right? Like what Brooke said earlier, hydration is extremely important. Getting enough fiber, meal timing is actually really important. Eat a good breakfast, drink coffee with it if you can tolerate it. Mm-hmm. And what else? And protected potty time. You need to have time for yourself to go to the bathroom. And I know that for myself. I need my morning coffee. I can go without a breakfast and I can still go to the bathroom, but I have to have my morning coffee and I have to have that time where I can feel at ease to go to the bathroom. Like sometimes, life happens. Then you skip one day. And it is okay, because when your gut has the elasticity, even if you skip one day, you will still be able to go. But what you don't want to happen is your bowels to get stretched out again from the stool burden that is building up in there. You really need to have the tools to have full evacuations every day. We have an interesting questions here. What kind of IBS would it be if on average, every other day I have a solid BM, then about an hour later, a looser BM, and then soon after, very loose BM, all in one day? This triggers my hemorrhoid. Yeah, it sounds like, what do you think? We actually have a client that is somewhat like this. Mm-hmm. Mm-hmm. And this client actually has a food trigger. But what type of IBS it is, if every other day you are having loose BMs, then this is more likely IBS diarrhea than IBS constipation. If you're having a bowel movement every other day, it's probably not mixed bowel type, because there are different categories. You have to categorize your bowel movements into different categories for the room, 4 criteria. So one of the criteria for IBS-D is more than 25% of your bowel movements are diarrhea, are loose stool. So if, you're having one solid stool followed by a lot of loose bowel movements, it could be food intolerance related. In cases like this, you really want to understand, what food it is that triggers it and avoid your food trigger moving forward. Now, it may or may not be food intolerance, right? We also want to look at medical history. What kind of medications are you on? What supplements are you on? What food you are eating? What your family medical history is. So there are so many factors that affects, what is causing this. But IBS-C, in a nutshell, consistency for evacuation daily is going to be key. And then work with providers who understand how to help you get to consistent full evacuations every day is going to be key to really treating it. I would say our IBS-C patients, once, they figure out their trigger and once they are using all the tools that's available for them, they are having consistent, good bowel movement every single day, even if, they've had really impacted colon in the past. But it's not a magic cure. Your guts does not rebound from this to this overnight. It really does take consistency. So that is IBS constipation in a nutshell and treating it, which is also why we always recommend a program approach, right? Getting consistent support. And instead of, trialing multiple medications, trialing multiple supplements and or eliminating food on your own. Annette says here, thank you. I've been following you for a while. You are very welcome. We hope that is helpful for you, and we are just sorry if you have multiple diarrhea or urgencies a day. It's really, really difficult to live a normal life when that happens. I hope you can get the help you need. We are always here. Well, our enrollment is closing tomorrow, so just FYI for everybody else listening. Okay, let's talk about our last topic. For anybody joining now, we are talking about 3 things today. We've already talked about the cause of IBS. We talked about IBS constipation. Our last topic is IBS diarrhea. All right, Brooke, you want to kind of share what we see in clinic a lot?
Yes. So for diarrhea, we really want to see what people are eating. And which is probably the most important to see if there's a food trigger, possibly a FODMAP, of course, and fiber content of diet. So soluble fiber can be very helpful for diarrhea. Also for diarrhea, we want to make sure people are hydrated because dehydration can actually make diarrhea worse. What am I forgetting, Jessie?
Medications causing diarrhea?
Oh, medications, yes.
Supplements,
yeah. Yeah, if you're on medication for something else that you need to take and it's causing diarrhea, so it would be managing it maybe with a fiber supplement, Imodium, something like that. Supplements. Number one thing we have people do that come to us with diarrhea is stop a probiotic.
Yes.
We see that all the time. That the probiotic is actually contributing to the diarrhea. And we need you to be off the probiotic to see what kind of your baseline is about the probiotic possibly wreaking havoc in there. So yeah, both IBS-C and IBS-D and IBS mixed are, I like to think of it as a puzzle and putting all the different puzzle pieces together to make you feel better and have you in a good spot with your managing your IBS, that you don't miss out on life events.
Yeah, and I think with IBS diarrhea too, let's go back to talking about the probiotics. Sometimes, people are being recommended probiotics. Now, it would be good if the probiotics helps, but a lot of the times what we see is people have constipation or bloating, and then they take a probiotics thinking that, well, this is promoted for gut health or, improves bloating or it resolves constipation. And sometimes it does, but sometimes it does not stop there. It makes people run to the bathroom. And we have had so many clients in cases like this is they take a probiotics, it makes them run to the bathroom nonstop. Even after they stop the probiotics. And what has happened is that the probiotics have shifted their gut microbiome, giving them SIBO, and potentially even changed, just change the composition of their gut microbiome. And in cases like this, it's quite, sometimes it can be quite debilitating. We see people losing weight over this. And we have, even after stopping the probiotics, sometimes it may require antibiotics to really treat the overgrowth. So if you are taking a probiotics, if you're running to the bathroom, even if you're not working with us, please stop the probiotics. Always talk to your provider about it before trying any supplements. Now, we have also seen people, one of our former clients who is actually a pharmacist herself. She's the loveliest person, and she came to us for IBS diarrhea. And sometimes, what we see is providers recommending probiotics to patients, and it makes their patients' symptoms worse. So this one particular client, she came to us for IBS diarrhea, and she went to see a different GI dietitian in the past. And the GI dietitian recommended a probiotics for this client. And the interesting thing is she did recommend something that has evidence for IBS. However, it has evidence for IBS constipation, not IBS diarrhea. And potentially by doing that, actually for this particular case, it made her diarrhea a lot worse. So, even if you don't work with us, please do not try random supplements without professional guidance. Make sure you find somebody who is who knows what they're doing, who is an IBS expert, because we see it all the time as people being put on a tremendous amount of supplements. One of our clients, Liliana, she came back on a program because she did have a food trigger. She came to us for IBS diarrhea. She actually was working with a different dietitian at first, and that dietitian put her on a ton of supplements. And I'm not kidding you. It was natural enzymes, herbal supplements, probiotics, right? For sure. Every time we see that, we just say, let's stop everything and let's help you get back to your baseline quickly and see, what your symptoms look like at baseline. Is your diarrhea as bad? And oftentimes the diarrhea actually isn't as bad when we help them, remove everything and get them back to baseline. Then we kind of assess where symptoms go from there, right? If you still have quite a lot of symptoms, then while we are assessing that, we're also assessing what our clients are eating. What are you eating? Could these be potentially FODMAP triggers? Or could this client potentially have non-celiac wheat sensitivity? Then we may recommend a different elimination diet altogether. And we do have to discuss and decide, does the client need an elimination diet? Because if we don't have to put somebody on an elimination diet, we won't. It's very difficult. But, even if we don't recommend the low FODMAP diet for somebody, because their symptoms are stable, we don't need to add on a restrictive elimination diet. We can still do a challenge, right, for these foods to see what your tolerance level is at. Can you tolerate it or not? And how much of it you can tolerate? And most of the time, it's really giving the patient, our clients, confidence that they can eat these food again. And one of our clients who's had diarrhea for a long time, I think at the beginning, she said, I'm never going to try onion again because this is just, I know I've had so many, incidents where I ate onion, it gave me diarrhea right away. I'm so afraid of it. But, after working with us for a while, she actually agreed to doing an onion challenge. And, by doing so, whether you tolerate it and how much of it you tolerate it, this is going to help you build the confidence in the future, knowing that, hey, I can eat some of this and I'll be okay. Right. So how did I get there? Well, I was saying, be careful of supplements and don't just cut out food on your own, because oftentimes what we see is people cut out way more food than they need to. And of course, if you are trying to reintroduce food by yourself and unsuccessful, you also need to look at, what is really going on with your gut, right? If there is something actively going on and you don't resolve the root cause of what's causing your symptom, you try to reintroduce FODMAPs, you won't tolerate it. But once you resolve the root cause of what's causing gut issues, right? For example, one of our clients, Jessica, who is a healthcare provider herself, we actually help her get to the right diagnosis of non-celiac wheat sensitivity. And once she removed wheat from her diet, she's able to reintroduce all of the FODMAP groups one by one. No issue at all. One of the things she was so afraid of was garlic and onion. And guess what? She could tolerate both of them once she removed wheat from her diet. But she's somebody with non-celiac wheat sensitivity. Not everybody has that, but if you do, you need to identify it and remove that trigger from your diet. And then there are other cases where people come in, like Laura's case. She actually has SIBO on top of her IBS. And what we did is we identified SIBO with her and then, have her get tested with her provider and get her treated. Once she's done treated, we reintroduce all the FODMAP groups back. And she only had one group where she didn't tolerate at higher levels. And she knows exactly what to do to manage her IBS diarrhea after that. So if you've been trialing, or if you've been recommended any kind of elimination diets, please don't do it on your own. Work with a trained dietitian to help you get better. All right. Okay, I think that's it. I think we've talked about so many things today. We talked about the cause of IBS constipation, what to do, and IBS diarrhea, what to do. And if you do suspect a food trigger, work with professionals. And IBS Freedom Enrollment is ending tomorrow. That is our VIP small group program where we work with you for 14 weeks to really help you get a better understanding of what is going on with your IBS, what's causing your symptoms. If you have any food triggers contribute to symptoms, we will help you identify that as well and also create a long-term plan that works for you. Number one, in preventing symptoms. Number two, if symptoms do come back, what to do to bring symptoms down to baseline as fast as possible. So that is our small group program in a nutshell. If you have any questions, you can drop them here. And I think we had some questions early on that I don't know if I could still find it. Oh,
Kate
here.
had one.
Yeah,
Did
okay.
you see Kate's? Yeah.
No, why don't you read it? I don't see it.
Okay. What are tips to include on a daily basis to improve gut health?
What is that?
What are tips to include on a daily basis to improve gut health?
Oh, that's a great question. Okay.
Yeah.
Hydration. Make sure you are drinking enough fluids. That is always key, right? Nothing runs well in our body if you are dehydrated. Number two, the most important thing, really, the only scientific evidence we have so far in improving gut health is eating enough fiber every day. And that is 25 to 35 grams of fiber. There's a range, everybody's a little bit different, but you got to hit your fiber sweet spot every day so that you have good gut motility. And the key is not just getting enough fiber. The key is also eating a varied diet. We know there is the American Gut Project. It's not perfect. It's not a perfect research, but it's a starting point. What that research did is looked at people eating 10 different 10 different plant-based food per week versus 30 different plant-based food per week. What they noticed is that people eating 30 different plant foods every week have way better gut microbiome composition compared to somebody who is eating only 10 foods per week. Now, when I say better, I really mean a more diverse gut microbiome. There's no better as in you have, better good ones, worse bad ones. It's not that, but the diversity is what we are really looking for as far as what research knows at this stage. So that's that. So tip number one is drinking enough fluids. Number two is getting enough fiber and getting a variety, different types of fiber. And number three is actually sleep, getting enough sleep. We know people who don't get enough quality sleep have lower diversity in gut microbiome. And we also know that people have less sleep also tends to have more anxiety, more stress. Sleep affects so much of us. So with general gut tips, those three are my best three. What do you think? Anything else to add?
No, definitely that. But an important reminder is it's 30 different plant foods over the course of the week, which is fruits, vegetables, grains, spices, anything from a plant. I put cocoa powder in my kid's smoothie every morning. That is a plant food that counts. So it's not just getting 30 different fruits and vegetables. It's all plants. So you want
Right.
diverse grains, diverse spices, all of that good stuff. So it makes it a little bit easier. You can actually find checklists on the internet that you can go through and check off your different plants for the week.
Yeah.
And again, it's over the course of a week. It's not, trying to kill yourself to get 30 in a day or something like that.
Well, we do encourage that in our program. Well, not 30 in a day, but 30 in a week. We do have, in part of our course, we talk about how to improve your variety intake. But if you are on any kind of elimination diet, it's really hard to get to 30 different types of fruits or of plant food every week. So, make sure you are not cutting out things that is, actually good for your guts. And you know what is actually very good for our guts? FODMAPs. And that's one thing I hate about the low FODMAP diet is people think that it's a long-term diet and they cut it out for a long time. In the long run, that is detrimental to your gut microbiome. It can reduce the diversity of your gut microbiome because FODMAPs are fermentable carbohydrates. They are prebiotic fibers that feed our gut microbiome. And when our gut microbiome is happy, our gut functions will improve. And that is really the key indicator of long-term gut health. Is happy gut microbiome. And we know that they dictate so much of our bodily function, right? They can help us improve our mood because a lot of the serotonin or the dopamine are made in there. And they can help us reduce the risk of cardiovascular events in the future. And, so don't just focusing on cutting out food. One of the things about managing IBS is, more than it's not about cutting out food. It's really about what we add back into our diets and making sure we are supporting proper gut function in the long run. Now, if you are, you want to learn more about this, we actually break it down into little bits and pieces in our free IBS Relief Masterclass. You can comment any of my post class to get the link, or if you're interested in working with us, you can comment group GROUP to get 3 links in your DM, and one of the link is our free IBS Masterclass link. Now, we had a question earlier on. Somebody asked, is it related to barometric changes? I usually have
that was gas.
That was gas.
That was when you're talking about bloating and gas, or bloating.
Okay. I usually have migraine, but it's gone after this gut symptom started. My migraine is usually triggered by barometric and hormone changes. Hormone changes triggers migraine because hormone changes can cause our blood vessels to dilate or to restrict. And when it restricts, which usually happens when our hormone drops right before our periods, that's when a lot of people do experience migraine. So it's a very common thing for women. But we also know that in our program, people get migraines from eating their food triggers. This could more likely be related to a particular type of food trigger that not everybody have, but sometimes it's something we see. Did we have somebody who came onto the program and came onto the podcast and said that they're migraine? Oh, no. Maybe it was a client that I followed up with last week. So she was one of our clients who had a food trigger, or maybe somebody who came onto the podcast and said, ever since removing her food trigger, her migraines went away. And when she did the challenge, the migraine came back. Yeah. It was one of our clients, right? Yeah. Mm-hmm. And I don't think it was on the podcast.
It was Kimberly.
I think
it was maybe Kimberly, I think. I think we have a new client that gets migraines too.
Okay. Yeah.
I've got to jump off soon.
Okay. I got to go too. Well, thank you everybody for attending. Oh, one last question. I can answer it. If you have to go, I'll answer it. Do you prefer to get fiber through foods or supplements? This is a really good question.
It's a really good question.
Yes. And we want to address this so we don't leave you hanging. Yeah. We do recommend people to get fiber from food when possible, because again, right, we're looking for that variety of plant food in your guts to feed your gut microbiome. But we know sometimes it's not always, achievable to get 25 to 35 grams of fiber per day. using a little bit of fiber supplements can be helpful, but they should not be your main source of fiber. They should be just supplemental to help you get through to your goal. So maybe 1 or 2 servings of fiber supplements is okay. Now, if you're new to fiber supplement, you want to start small and really increase slowly and increase hydration as you go. Because otherwise, for those of us with IBS, if you just dump a bunch of fiber into your gut, it's going to trigger symptoms. It can cause a flare-up. So be very mindful. And again, at the end of the day, what we really are encouraging people to do is increasing your dietary intake of different plant food. So don't restrict. Our goal is always to help you identify your triggers so you can eat more food and more variety in the long run. And that's going to be the best for your gut and your gut function for the long run. All right. Thank you so much, Brooke. And thank you so much, everybody, for joining us today.
Bye.
All right. Bye. We look forward to seeing you in our program.